Good morning.
Good morning. How are you?
Good. How about yourselves?
Doing well.
Good morning. I'm just playing with the technology.
I'm glad you're doing better.
I am feeling way better than I was. I look better than I look too. Y'all should have seen me Monday, Tuesday, and Wednesday. Oh God.
Oh,
I was scared of myself. Okay.
Mhm.
that's fun.
All right. So since we are live, we can for a little bit, we can do intros. Thank you. We can do intros. And so sorry, y'all. We can do intros so that way we can because we are live streaming on YouTube. And so I'll introduce myself first. I'm Amanda Payne, the founder of Nurses in Tech. I'm excited to have you guys here today. Excited to chat with Katie Davis, who is our guest, who is going to talk to us about being a nurse and how being a nurse that has worked in bedside and now has the ability and the experiences of leadership and being able to work in the boardroom is such a powerful thing for not only nurses but also for the organizations and the companies that may employ them. And so I'm going to pass it over to any of our viewers that are here that want to introduce yourself real quick. We're going to let Katie take over at 11:20. Just tell us your name, tell us where you're located, and why you joined to chat with us today. Don't be shy. We're really fun here at Nurses in Tech. So, Mr. Charles, you want to start us off? Just tell us where you are, where you located.
Hey, I'm in Atlanta. How are you guys?
We are good.
Yeah.
We are good.
I joined. I had done some work with the Department of Defense in technology with Cerner implementation. I was the physician lead for provider adoption for the implementation for the United States. And I subsequently actually developed a mobile application that has a NFC wearable device for emergency use. I'll put the link in the code, but I think nurses in tech is something that's truly, truly needed because we are the true innovators because we're at the bedside and we understand the application of all technology.
Well, thank you for joining us today. And I love to chat with you about being a guest real soon. We can talk about what you got going on.
Oh, yeah.
All right. Thank you. Who else wants to do an intro? If you are not on camera, I will let you know on the YouTube live, you will not show up. And since all of you wonderful nurses are so beautiful and handsome, if you want to be seen, you have to be on the camera. But if you could at least tell us your name and where you're located, that would be great. Hi,
I was
Tammy.
on camera because I just got back from running and I had like this allergic thing. So I apologize for my voice. My name's Tammy. I'm a nurse living in Ohio. I work in education. And I just have a lot of interest in how we can move forward in nursing with a different focus and framework than what we've been doing.
Thank you, Tammy. It's good to see you. It's always good to see you. All right. I'm going to assume that Amy and Aaliyah are unable to introduce themselves because they are members and they always have something to say. Leah, thanks for joining us. Leah Woodley is one of our partners. But we're gonna go ahead and just get started. We're gonna do something a little different today. We normally don't have a presentation style event at Nurses in Tech, but today Miss Katie Davis is here. And she is going to do a presentation style. I am personally a little excited for that because I always like to not experiment, but kind of experiment with what works and see what really engages and captures our audience and who our audience really is. And so I'm excited to hear from Katie. So I'm going to let Katie tell us about her because I tried to put an introduction together for her, and to tell you guys all the truth, I just did not feel like I was doing a great job. I should have had her write it out because I was looking through her LinkedIn and I Googled her and I was just like, She left out a whole bunch of stuff that she's done in life. Oh my God. And so I was a little overwhelmed myself, and I was like, I just can't introduce her. So I'm going to have to let her introduce herself. And so I'm going to let Katie introduce herself, tell us about who she is, and then she will go into her presentation. But I do want to thank Katie for doing this for us. I love Katie. I will say Katie is like, you know, you guys, I always got to give my personal here. Katie is like my Elon Musk guru best friend that I kind of like harbor from the nurses and tech community for like myself.
So kind.
I really love her spirit. I really love her experience and how humble she is, and just how willing she is to take a risk on nurses and tech, but to just be open with her advice and experience and her encouragement. I can always count on Katie if I send an email or a message that says, hey guys, I don't know what I'm doing, if this is a good idea, or hey, I'm not feeling well. I can always count on Katie to send me a text that says, I saw your message. You are doing a great job. You are amazing. Keep doing what you're doing. And it is like always at the best time. So I just thank her for being an amazing human as well as an amazing nurse. So thank you.
Thank you. Way too kind, Amanda. Amanda also likes to hide all of her talents, so we're in good company here. First and foremost, happy Nurses Week.
Yes.
For everyone that's here that's a nurse, thank you for all that you do for us every single day. Really happy to be here and chatting with everyone. My background, I've grown up in healthcare. I've been in healthcare for well over 20 years. I was volunteering / candy striper at age 12 when my parents were able to take me to work because they both worked in the hospital. And it was kind of all over from there. So I became an EMT at a very young age, was then training other newer EMTs probably by the time I was about 16. And ultimately continued on throughout my career to continue to develop, worked in the emergency department as an ED tech, was a nurse manager, nurse practitioner. I have a master's in forensic nursing, as well as a postgrad certificate as an acute care NP. So I've had I think honestly going through every single area of healthcare has been really beneficial for my development and career, and just working my way up and understanding every area. I am a mom of 2 little girls. So 1 and 3-year-olds running around. If you hear them screaming, that would be why. And wife to also fantastic business leader. I have been the SVP and head of clinical for a couple healthcare technology companies now, and consultant for over the last 10 years. So I have tried to leverage my skill set, really honestly teach myself along the way how to operate not only as a clinical leader, but also as a business leader, and really excited to share my experiences and really answer any questions that folks have. I know a lot of times we have folks reaching out to us saying, hey, I want to get out of bedside, or I want to get into tech, and they just don't know how to do it. So I'm happy to share kind of my journey, a couple like tidbits that have helped me, and honestly answer questions and have conversation along the way. All right. Anything before we start that folks are really curious about?
So you guys, this is interactive. You can ask questions. You don't have to raise your hand. If you can't come off camera, you just want to throw your questions in the chat. I am reading the chat, but please ask Katie questions. If this was ever a time that you can ask questions and get tried and true information, this is a time. So any questions you have about leadership, business startup, consulting, how to change the trajectory of your career, If you just feel like you need a change, where to start, even how to think about that, even how to get support.
Absolutely.
I need all of that. So,
You got it. Don't
so
worry.
everything you've got to share, I need.
You're in the right place, Tammy.
Excellent.
Fantastic. All right. So, navigating healthcare, nurse's guide to the business side. So we are all dedicated nurses, compassionate, skilled, right? Making significant impact on patient well-being. And then imagine the same nurses navigating the intricate web of healthcare business, and really trying to understand how to transition from caregiver to well-rounded healthcare executive. So a number of areas we're going to touch on: leadership, technology, networking, understanding the ecosystem, and then financial literacy. So on the leadership side, nurses are really natural leaders at the front line, right? We are communicating every single day, advocating for our patients, talking to family members, calling the doctors up, especially folks working in critical care or even those on med surge in the hospital settings, calling the residents and saying, hey, this is what we have to do, right? Actually helping to teach them and lead them is always kind of part of the job. So being those natural leaders on the front lines, it only makes sense that those nursing leaders become great business leaders as well, and really help businesses make appropriate key decisions. There are a number of healthcare companies, specifically healthcare technology companies, that may not have a nurse on the board, right? May not have a nurse in the executive leadership, may not even have a clinician, right? So that is something that I think we really need to change and really rise kind of nurses up to get to that place and make sure that they do in fact have a seat at the table. How I've done this in some of leadership, in all honesty, I had terrible training on leadership in healthcare through my healthcare journey. It didn't exist when I was in the hospital. You essentially learned from the managers above you and around you, and it was you either learn what to do or in many cases what not to do. Right? Like that was like, I don't want to be like that. So it's hard to find great leaders in healthcare. So it's really up to us to do our own self-development. I ended up doing a fair amount of reading. I love audiobooks. That's a lot easier because you can like do other things while you have the audiobook going. Really kind of dove into a couple specific areas. I love Patrick Lencioni's framework in particular. The Advantage is like his entire framework, the 5 dysfunctions of a team. All of that has been really helpful in leadership, and then really understanding how everyone works, the different personalities. Part of it is really even doing communication exercises. I do it with every single one of my team members that comes on board now. I ask them to do the communication exercise. And then I see my interactions with people. There's like 4 colors. It's how people communicate and how kind of you need to interact with them. I see my interactions in those colors, in all honesty. And there's like a really nice, helpful like grid that then says, oh, if this person's blue, it means they're really detail oriented. This is how you should communicate with them, right? If they're yellow, they're visionary. You don't want to go into details, right? Like with those folks, you want to communicate differently. So really just leaning in and doing a lot of that development myself is honestly how I really grew the most and learned the most along the way. I'll pause there. Any questions?
So I don't have a question, but while everybody is thinking, I do have a statement. I think it's really interesting and really worth going into some more conversation about how you said that most of us learned in leadership from the people above us. And I'm going to say, I'm not the only one, I'm sure, but I always learned, yeah, I don't want to be like you. As a matter of fact, you're not a great leader. And so I'm going to use this as an opportunity to purposely learn what you're doing. So I know what you're doing wrong because I know what I feel and I know what I'm not getting, right? But even in that, I think it's interesting because we end up still in this place where we're still, you know, we develop skills of what not to do, right? But it doesn't necessarily mean that we learn how to actually lead even in those interactions. And so I bring that up because I just think it's really important, not for us as nurses, but not just us, but us as the profession to understand when you put people in leadership who don't know how to cultivate and train other leaders, it kind of does more harm than good because you kind of just know, I want to be a better leader, but I still don't exactly know how to lead.
Yeah. Yeah. I think that's so true, Amanda. And I saw Charles, you come off mute there. So feel free to jump in.
Well, we're putting questions in the chat. So
yep,
I don't know if you're going to read them out.
I'm reading the questions in the chat. But you can ask your question, Charles. I see it. I was just reading it, but you can go ahead and say it.
So in my brief experience in leadership, you learn from everybody that you encounter. So I was an administrator at Georgetown when I was in grad school, and I was the hospital administrator at night. And I learned from the guys in housekeeping. I learned from the guys who were, doing dietary. Everybody that I worked with, I encountered how their perspective on what their ultimate goal was for the organization, as well as the leaders. Like Amanda said, the positive and the negatives are translated into my strategy. But to Katie's point, when you're early in corporate America, you have to find someone that you can mirror. You've got to find somebody that can be your mental mentor so that you can mimic them until you develop your own style. And you'll incorporate many of the things that they do that are effective into your style until you come up with your little own individual recipe. So I agree.
Absolutely. Great point. Awesome. Thank you, Amanda, for sending the link there. And happy to share communication exercises or anything else that's kind of valuable to people along the way. Feel free to reach out. I'll give folks my email address at the end of this too. All right. Technology. So technology. The landscape is changing so quickly right now, right? Yet there's always been a need and use for leveraging technology in healthcare. There's technology-enabled healthcare services companies, right? Various kind of health tech companies, a lot of telemedicine, AI right now, really trying to leverage data, right? So you don't necessarily always think about data when you think about technology, but that's a huge part of making good decisions, right? Is being able to, one, build something so that there is data to look at, then two, be able to actually pull that data out of what you have built and then be able to subsequently analyze it to make the right decisions, get those great insights, and ultimately lead to better patient outcomes, right? That's the ultimate goal here. That is often why many of us are at the table, is we are caregivers kind of at our core. And then as business leaders, it's kind of part of our responsibility to make sure that everyone else that may not be a caregiver or a clinician is thinking in that way for additional like developments and making sure that we're always putting the patient first. Questions there or thoughts?
Katie, to that point, I think that, these companies like Cerner and Epic, God love them, have built the foundation of who they are from the brains of nurses. We do brain dumps. We give them application feedback. They even look at our workarounds to their solutions and say, hey, how can we improve this functionality so that they can fit the needs for the organization to be able to capture that performance? My
Yeah.
biggest fear is that everything's so task driven now that I'm worried that it's going to burn the nurses out.
Yeah. I think you're so right. There's also a little nugget in there, like that you said about following the nurses, using their workarounds, learning from their workarounds. Nurses are great innovators, right? They have to innovate every single day. And you're so correct in just following them, watching them, seeing how they operate. You will find solutions that can be built, whether it's into technology, into a product, program, all will be really beneficial. And then the burnout, you're right. I mean, honestly, already though, folks are burning out, whether it's at the bedside in the hospitals. Unfortunately, there's a lot of understaffing going on. Folks don't feel like they even want to be at the bedside anymore, right? Which is why a lot of folks are looking to get out, looking to get into tech, looking to get into these other areas. But make no mistake, even working for a telehealth company it's just a remote position with the same amount of work, right? Like I think there's this thought process that, oh wow, it's going to be so much easier. I'm going to be home. It's remote. You get sure all of your travel time back, which for many of us, that's a huge difference, right? That's very valuable. But no, I mean, I'm glued to my computer, right? Like 9 to 6 every single day, doing the work. And at this point, I'm in leadership and have leadership responsibilities, but it's the same for those at the bedside, and the virtual bedside, right? They still have metrics to meet. You're right, Charles, right? Like they're needing to still see as many patients, but just doing it remotely.
Well, the scary part about what we see now, especially with tech advancing so fast, Katie, like you're talking about, and I mean, every day it's like new things that are coming out. The squeeze is so hard on your performance. So
Yeah.
I've talked to nurses and done workflows with them where they say, well, hey, listen, they want us to be able to give our meds within 30 minutes of it, the order being available to us and pharmacy having it ready. And I'm like, well, they got to take into consideration the other variables that you can encounter with the patient, that you can't just have it be cookie cutter structure. It's got to be able to accommodate some of those things. And we hope that the organizations are flexible enough and empathetic enough to be able to see those things, because it's really going to affect nurses' ability to feel like we're part of a team and we're all this big family that'll take care of each other versus being a cog in the wheel.
Absolutely. Honestly, that's this entire conversation, right? Is how do you get nurses from the bedside into the boardroom to be having those conversations, to be saying, hey, you can't just build this thing in a room. It's not a widget. Like these are humans, these are patients. This is the real kind of world, right? And helping to bring some of those insights to light. Tasaya, you have your hand up. Hi,
Sorry,
welcome.
I'm a bit late, but really nice to hear your talk. I just really appreciated what you said about virtual care, because I helped build and then lead a team of over 50 care providers across different virtual clinics across the US. And they're still like, most of them NPs, and like they're still like not getting to pee because they are back to back to back to back with their patients, because the patient is like, oh, I have a 20-minute visit with you. That means you enter. It's not like I have a 20-minute visit with you and then I enter the room for 5 to 10 minutes and then my MA goes in and I go out and I chart whatever. It's like you enter the Zoom and that means I get exactly 20 minutes with you, and then my next patient, and then my next patient. And so I think I do like worry a bit about, I feel like there's a bit of praying going on with some of the like, leave the bedside, like it's going to be so great, like to leave the bedside, like, and it's like amazing. Like I think that there should be nurses all throughout every aspect of the healthcare system, but I think it's kind of a false narrative to be like, oh yeah, once you leave the bedside, everything's just going to be roses and you're going to be like skipping and dancing and happy and be able to relieve your blood or whatever you want. So I think those are things that we should have as nurses, but it doesn't automatically mean you have that once you leave the bedside in person.
You are so right. And that's honestly, it comes back to like the business of healthcare, right? Like we're going to get into later, like the ecosystem, financial literacy, but like there is a business of healthcare now. There is private equity in healthcare. There is venture capital in healthcare, right? Like this is you build, you grow, you create financial returns. So like that exists, and how do you operate within that ecosystem and still build something amazing, right? How do you have more than 20-minute visits, right? Where I'm a clinical leader right now, we have 60-minute visits, like probably unheard of, right? Like, but that's what we do. That's because our patients are complicated. We know and want our nurse practitioners spending the time with them. And still though, we have feedback that it's not enough, right? Like, so it's such a balance of how do you create a system that works for the patients, works for the providers and all of the care team, as well as ultimately gets you a financial return, because that's what the business is being measured on as well. So it's the clinical outcomes and the financial like outcomes.
Okay, can I ask a question right quick?
Yeah, of course.
So how do we handle the conundrum of the nurses now realizing their value, not in the clinical space, but from a real intellectually structural standpoint? So when I was in grad school, Press Ganey and all these guys came to us and they were evaluating our skill sets based on what we knew and what we did for a living, right? And they said, hey, if you're going to look at the person who affects the outcome the greatest, the nurse is really the catalyst for being able to measure whether or not the patient does well in the end of the outcome. So our ability to be adaptive, our ability to problem solve, critical thinking, just the urgency of the being able to handle the stress of care puts us in a position that we have a talent level that could be taken over to the business world and absolutely be dominant.
Yeah.
So now you've got the nurses understanding that, and they're exiting, going into the corporate world. And that's something that hospitals are struggling with now, is being able to manage that type of dynamic.
Yeah, you're so right. So I have so much to say about that. So little time. So there is so much going on right now about nurses kind of recognizing their value, and really honestly, nurses trying to also though help society recognize their value, right? So right now, as I think probably most may know, nurses in the hospital system at least are just folded into a room rate. Like that's it, right? Like there is no line item for nursing. There isn't, this is the value that the nurse drove. That doesn't exist. There are some reimbursement mechanisms and code sets in the outpatient setting, but honestly, they're few and far between. You can count them probably on one hand, right? So how do we help society recognize nurses' value? They're noticing it for themselves right now. They're starting, I think also to Saya's point, they're starting to come away from the bedside because they're like, well, I want more. Like, I recognize that I am a critical thinker, I am an innovator, and I am a leader. I can make these decisions, right? So I think if there's any way for wherever nurses currently sit to create career paths to get them there, that is going to be extraordinarily valuable, right? Whether it's in the actual hospital, where is the career path? Where is the leadership training that none of us ever got, right? Same thing if you are outpatient or even in some of these tech companies, like there has to be a real effort to figuring out what is the career path, how do you help people like elevate and get them there. And honestly, a lot of us don't do it well. I mean, even though I sit kind of on the executive team, we try to create career pathing as much as possible. There's also like all the fires you have, the time, right? Like, how do you do it all? And how do you prioritize? But whenever possible, to really try and help prioritize getting some of those nurses that kind of career development is huge. That's also why, honestly, like, I love trying to like coach and mentor nurses and help them continue to figure out what that like right pathway is for them.
Yeah.
Ashley, I see you have your hand raised too. Oh,
Yeah,
sorry,
really-
Mandy, go ahead.
Real quick before we continue. So we first of all, I'm not going to say that I'm shocked. I'm fully aware that this conversation was going to take a little longer than 45 minutes. So we are coming up upon time, at least by our timing. We normally allot an hour. So we can stop at 12, or if Katie has till 12:15, we can do 12:15. But I do want to let you guys know we're coming up on time. Now, I'm going to give you guys the Amanda Payne answer to Charles's question. And if you've listened to me talk and you know me already, then you know exactly what I'm going to say. Nurses in Tech was exactly created to do what we're talking about. Now, this is the thing. We can talk about how can we help hospitals? How can we help corporations? How can we help companies? We can talk about that all day, right? There are enough people having that conversation and trying to come up with complex answers. And the reality is we have to ask ourselves as nurses, if we know that we hold value, we know that we hold innovative ideas, we know that we hold patient education that can change the trajectory of a patient's life, if we know that we can assist one another and we speak the same language and we can have a conversation across the table from one another that is not competitive, because we're not the hospital, we're not the company, we're nurses, guess what? We come up with a quicker and an easier solution to our own, to their questions. We're saying they're their questions, but they're really questions they should be asking us to have the answers. So we kind of have to make a decision. And I'm not saying that all nurses have to, abandon the hospital or anything like that. That's not what I'm saying. I'm not saying you have to abandon.
You can drive to Sad, we'll all talk.
But we do have to start thinking about it as most nurses want to help patients. Like, we care about the outcome of patients. And as we already know, if we play this institutional game, right? And I'm not saying we shouldn't. Actually, I'm just going to say there are a lot of organizations, nursing organizations focus on the institutional structure of healthcare. We need nurses that can either do that and this, but we need nurses that will come over here and say, yes, I know we need to fix that, but I'm more into creating and taking ownership of a solution that can help patients now. Patients die every day from things they don't have to die from. Getting them closer to a nurse that has the information and can actually take the time to service them and have a conversation with them without worrying about talking to the next patient, without worrying about if insurance is going to pay them, without worrying about what documents they have to fill out. That's what patients need. And I just think the more nurses we can get together and we could work together and we communicate and we learn from one another to create these structures, like Katie said, healthcare is a business. There's a revenue model that is not even being explored, and there's revenue models that need to be explored where nurses are concerned, where we are reimbursed for what we know we're great at. And guess what? They know we're great at it too. They're already getting paid for it. So we need to come over here and work on making sure we have a voice loud enough that demands that we be valued and that we be included in the conversations and that we don't have to keep fighting to get in the conversations.
Absolutely. All right. I'll go over this one quickly because I think getting more to the ecosystem and the finances is probably where it's at. But networking, what you're doing right now, right? Like, honestly, joining a group of like-minded folks, a community like Nurses in Tech is huge. Understanding what is out there in the landscape. Healthcare is always changing. So being able to have those conversations, connections, whatever it may be, just continuing to broaden your horizons, it's huge. We're not used to it, honestly, in healthcare. I'm actually surprised at how few healthcare leaders are on LinkedIn, for example, right? You go and search them and non-existent. So really just trying to get yourself out there, have a LinkedIn account and profile, connect with people, talk to others. It all truly kind of makes a difference. Ecosystem. So the ecosystem is a lot of what we were just talking about, right? So healthcare isn't just about treating patients, although that is honestly our main focus, right? It is this vast system of economics, policies, regulations, treatment considerations, all of which is really important to understand how the pieces fit together, because that is how you become a fantastic business leader, right? By understanding what is a CPT? What is a DRG? Like, what do those things drive, like, for revenue streams, right? How are folks getting paid? How do you set up a medical practice across 50 states, right? Do you know the state specific regulations to do so? Or how do you at least get the information? These are all things that, as you're operating a business in healthcare, you know, right? The amount of time I've spent with lawyers, compliance folks, right? My finance team, that is truly kind of how you put all the pieces together. You have to make a great model for patients that's going to drive fantastic patient outcomes. And what should follow is the revenue, right? If you have a solid kind of model that you know you're going to be able to take care of patients well, you found either the code set or the value-based arrangement that's going to make it happen, by all means, that it will create a sustainable business that is great for patients, hopefully great for all of the clinical team, and ultimately great for the business as well. Questions?
I don't have a question. I just think we need to do a whole nother session on this. That's all.
I agree.
And Katie, that's one of the questions that I put into the chat, is having us really understand how to build that ecosystem, because nurses will have great ideas, but they don't have an idea of how to operationalize it. I partnered with a small young consulting firm to come in to help to build my platform, and they took my idea to market within 18 months. To an international market within 18 months.
Amazing.
So it can be done, but we got to know what our limitations are. And as clinicians, a lot of time we're thinking so, focused on the objective that we don't know the nuts and bolts that we need to put in place. So that's just one thing that we have to really consider when building our ecosystem, is having those business people kind of come in. If you don't have a business background, having them come in and help you build that ecosystem.
Yeah.
So that you don't waste money and time.
Absolutely. Or have others that have been there support you, right? I mean, the consulting firm, especially a smaller one, right? I think that's probably a key there. Bigger ones are probably just out of reach in terms of finances for folks. But there are enough kind of healthcare business folks out there that have operationalized these things, right? I've done 2 startups at this point that have been pretty significant and large. I've set up operations across all of those, from being the first nurse practitioner to building everything out in between, and seeing ultimately over 10,000 patients a month, right? So it can be done, and healthcare is hard. I've seen healthcare operators, and then I've seen non-healthcare operators come in. Very different experiences, right? If you've got a non-healthcare operator that you're trying to ask for support, it's not necessarily a bad thing. Like, it can be good in terms of how they're thinking, and maybe they're thinking a little differently. You have to recognize that they literally don't understand patient care, right? Like, so they may tell you to go do X, Y, and Z, and then back of your head, you're like, but that's going to hurt the patient, right? Like, they just can't make those connections, which is why I think nurses are so powerful in business. You have the clinical knowledge and background, and you can learn the business. The business folks, unless they plan to go to nursing school, go get their MD, their NP, whatever it is, they're never going to have the clinical knowledge. So be like, the business stuff, it's easier to learn, right? Like, you can do it. and then be able to put all the pieces together for yourself.
Yeah. And I think that's really a big, I'm always talking about having these candid conversations, right? It's so important to get together and consistently have these conversations. Because I think we live in a time where innovation is like really priority right now. And you just never know, right? So Charles talked about a small consulting firm, right? Within your network, you never know what nurse has what information, right? That nurse starts talking to this nurse, and this nurse has a piece of information, and then this nurse has a piece of information. We actually have the ability to synergize and arrive at solutions quicker simply by working together. And I think Charles hit something when he said, we will tend to focus more on objectives, right? We will tend to focus on what we want to get done. I'm a do it person. So I'm over here like, what do you want to do? Okay, here, let's go do it and see what works, see what we need, see who we can bring along. If we fail, we fail, but we still learn something, right? And so I feel like this, I often say this fast forward failure is really important for nurses right now. We have gotten out of the practice of actually doing something. We just keep getting caught in the rug rate conversation of what needs to be done and what we could do and what we might need to do and what people won't let us do and why they won't. And the very few of us actually get to doing. Yeah. And I think that's why community is just so, so important. You know that you're not alone. You know that you're not the only worst person that sees what you see. So you're not crazy, right? And most of the time, nurses that have the vision to go further and to do more, we usually find ourselves in silos. And there's usually maybe one nurse, maybe two nurses, but you won't find a group of us oftentimes in the same place as it relates to thinking outside of the box.
Absolutely.
Yeah. And Kate, I think what I'm saying is that you're not allowing the business people to build your model. You're having them evaluate it. Because when you're trying to scale and you're looking at, forecasting your revenue sources and being able to, financially put yourself in a position where you're not in debt and you're not taking on venture capitalists, because those are the guys who really take your business over, and it becomes a whole different model of what you want. Yeah. You just want to be able to practice real good, sound business practices. And I know as a nurse, when I first started out, before I got my PMP and my master's, I owned the hospice program, and boy, it was a mess.
Yeah.
I got all the clinical service, I got all the licensing and stuff done, but from understanding how to do my branding, et cetera, and really scale the revenue I was bringing in into more marketing and being able to grow the business from there, I didn't have that expertise, and I could have used somebody to be able to help me be able to do that.
Yeah. Absolutely.
But for those of us who've done it now, oh yeah, easily, learn the skill.
Yeah. Absolutely. I couldn't agree more with you, Charles, right? And that honestly brings us right into the financial literacy. Like, similar to leadership, you kind of look around you and you're like, oh, like, who do I want to emulate? What do I not want to do, right? Nurses in general typically are not getting education on financial literacy here. Like, they're not getting education on revenue. They're not getting education on reimbursement, how to optimize, right? And that is truly a learned skill. And often you can't learn it from the people around you unless you have a finance person, or just as you said, someone been there, done that, right? The amount of time that I've spent in like CPT books and like, right? Like, literally like, okay, I know I want to do this thing. Is there a code for it? Can I get it reimbursed? Right. And you start to like chip away and build the model that you actually want, that's like reimbursable, sustainable, and is ultimately going to lead to the outcomes that you're hoping for as well.
So Anna said that she learned in nursing school that nurses do not handle money.
Oh no. That's terrible. Although very not surprising. So it really goes to show how embedded that concept is, right, in society, especially if our nursing schools are saying like, oh yeah, nurses don't do that. Like, don't worry about it. Those are the skills that are going to really rise everyone up, and ultimately be able to allow them to create businesses of their own.
Hey, Katie, can I say something to that note?
Absolutely.
Okay, I might be the youngest person here, and I want to start by saying I'm not a nurse. I'm not a nurse, so I actually double majored in finance and economics. So I'm on the finance side, the money side, and in starting startups with nurses, I've worked very closely with multiple startups, multiple nurses. I love working with nurses because they're a different type of people. One, they have a different type of love for what they do. They have a different type of care for other people. And they show a different type of passion. I think a different type of passion, especially when we do something in the medical field. It's a lot different than people starting companies that are not nurses or not clinical. So my dad was one of those companies with eLife, and we made his app, his website. We got him to over 100,000 users now. I mean, it's been great. But I think the my point in the finance side is that yes, you can learn money, you can learn numbers, you can learn terminologies, you can learn how to you can get a tax guy. I wouldn't anyone just do their own taxes. But you can get a tax guy, you might be able to do your own taxes, it's fine. But I think the thing that a lot of nurses miss is the marketing. And even doing finance, even coming from a financial background, I really started focusing way more on marketing, way more in development, design, because we're really reaching a digital age. So us having a footprint that's that makes sense, social media marketing or website development, just different types of marketing avenues you can use, SEO engagement, or search engine optimization. All these things are so serious because see some is understanding money and
Are you
enough to actually make it.
guys really quick? Are you guys in the same space because you are going in and out? We can hear.
Oh wow.
No, yeah, we're
Am I
in
going
different
in and out?
A little bit, yeah. But
Yeah.
I think we got most of it. And yeah, I agree. I think marketing is also huge, right? Especially if you're starting your own business. Amanda has it's one of her secret skills. Right. So she is fantastic at that. And it's true. That's not a skill that I have, in all honesty. I've got the business side, I've got the finances, I've got, right, all of those models.
Yeah.
But the marketing is definitely huge. And I think a lot of what Amanda said to you earlier of that community, learning everyone's skill sets and leveraging them is huge for sure.
You have to.
I think it's a big thing that I know in nurses in tech, I have found this is something that in having community, there are several things that have come up that I didn't plan. We didn't plan for, even as we did our initial interviews and decided that we were going to do this thing together. Nurses have skills that we are naturally good at and are passionate about. Right. So we found in nurses in tech that we have a couple business founders that have businesses. And they're nurses and they have businesses. Well, guess what? Those nurses that have businesses and even the nurses that don't, they have skills that they don't even put a value on because they're just good at them. We have more than a few awesome graphic designers in our community. We have website builders in our community. We have an amazing copywriter in our community, right? And so among other things, it's also important to realize when nurses decide to go out and own something, it doesn't always have to just be in the sector of patient care. There are other ways for nurses that can develop websites, nurses that understand business, nurses that understand marketing, nurses that understand SEO, nurses that we have a nurse developer in our community, a full-scale developer, right? They're out there. Nurses are multifaceted and multi-talented. And one of our missions is helping nurses to understand that they are badass. And yes, it's okay to go look for people that are skilled in other sectors. But guess what? There are nurses that are skilled in those same things. And something amazing happens when you get nurses that have other talents all in the same place.
Absolutely.
And you guys know how I feel about, yes, I will go get somebody to do something that's not a nurse. But if I can build up and I can support a nurse that can do those things in this ecosystem that I need to move my business forward, I most certainly go that direction. And there's a reason for that. And it's not to exclude people, but as nurses move forward in our power, and as we move forward and we decide to create a voice for ourselves that's not fractionalized, that means it's a voice that we've created as nurses. It's just got to be something powerful about that because we have not done it.
Absolutely.
I can agree to that. I think sometimes nurses still need to get their feet wet in certain areas, and maybe working with someone experienced in that area that's dedicated. I think, doing two businesses at once is always so hard. You have a nurse that does web development, but then you have a web developer, I don't know, that's willing to help a nurse get to her web development goals. I think that's just, I think I've never discredited working with the expert. Just like I say, don't go to your friend for advice like a doctor or anything like that. I just wouldn't do that.
Yeah.
But
Awesome.
Thank you.
Absolutely. I know we're kind of up on time, so it's really great conversation. Nurses with business knowledge are truly game changers. I fully believe that. We will be the leaders in healthcare, right? The system needs to change. There's a lot of work to do. And we are well positioned to make it happen. So thank you all. I appreciate the conversation. Thank you, Amanda, for having me. Very much appreciate it. And always happy to work with folks. I will put my email address in the chat.
I will send out, if you want, I can send out a follow-up email,
Awesome.
Katie, with the resources that you said you would send. If you want to send them to me, I'll send it out, a copy, put your email and things on there, so people can have it. Or if you want them to contact you individually, that's fine too. But I would love to send it out to everyone. Thank you, guys. I would love to have Katie come back again and go a little deeper into a couple sections of her conversation, maybe next month. If you think you would like that, just come off mute and say absolutely. So she will be pressed to come back and talk to us.
Oh, absolutely.
Absolutely.
You're not getting away, Katie.
And we can have a more tailored discussion on some of these topics that I think are most certainly needed and very important. So thank you, Katie. I appreciate you for taking time to chat with us. Everybody have a great day. And reach out on LinkedIn. I think you'll find just about everybody here is on LinkedIn. So it's always good to network with one another after we have these events. Come back and check with us next Thursday at 10 a.m. We will be chatting with a special guest of mine who I'm excited to talk about. And we'll put that up. I'll put that up later today. But thank you guys. Have a happy Friday. Happy Nurses Week to all the nurses, and happy Mother's Day to all the mothers. We were talking about nurses, but we have mothers and nurses on this call. And just enjoy your week. Be surrounded by love and blessings, and just have a great Friday.
Thank you.
You too. Bye, guys.